Hi, I'm Dr. Brian Maloney here in Atlanta, Georgia, and today we're going to talk a little bit about facelifting. The first facelifts actually started about the early 1900s, and they involved just removing a little oval of skin in front of the ear to try to remove some of the skin. It really wasn't until almost 70 years later that people began tightening some of the deeper layers of the face. When we think about skin, it's very stretchy. Think about pregnancy, how much the skin can stretch. So doctors in the 70s thought, if we tighten some of those deeper layers, that'll tighten the foundation. So the SMAS is a fascia layer that surrounds the ear and comes into the middle part of the face and surrounds all the muscles. If you've ever been to the grocery store and you see the cuts of meat and that white glistening layer on the meat, that's what fascia is. So the doctors would take out a little strip of the fascia underneath the skin and they would tighten that up, and that would help to lift the muscles in the middle part of the face. Well, in the 1980s, doctors came up with the idea of a subperiosteal facelift. The advantage to this was an incision would be made up underneath the lip and one back in the temple, and they would free all of the tissues of the cheek off of the underlying bone, and then they would lift that up. Well, the problems with that are that the cheek is a very active part of our face. The muscles go from here up to here. So every time we're smiling, we're eating. And so usually within a year, that cheek would be back down to where it started. The other interesting thing about that procedure, why it wasn't that great, is that the cheek pad is really divided into two parts. The upper part is firmly attached to the bone, and the lower part isn't. So for all of us, we start seeing that separation in the cheek as we begin to age. Well, about 1990, some doctors came up with another type of facelift. This facelift was called the deep plane facelift. So they were going through the same incision around the ear here, but they were going deeper and releasing some of the ligaments. With this particular procedure, they had to modify their incision to actually come out in front of the little tuft of hair here, as opposed to keeping it hidden back here. The other disadvantage of the deep plane facelift was it would take patients 2 to 3 months to recover, and the potential complications, facial nerve injury, were much higher than the traditional facelifts. So let's talk about the modern facelift. The modern facelift is really almost like a hybrid of some of the older techniques with some of the newer ones. With the modern facelift, my incision starts just above the ear, flows along the top curve of the ear, goes behind this little bump, sweeps underneath, up behind the ear and back along the hairline. I take a little strip of the SMAS and I recycle that, flipping it down into the back part of the jaw here, but undermining the front edge of that SMAS to allow even more movement and lift of that facelift. Once that's suspended and the neck tissues are lifted up, then we'll often combine something called fat transfer to help smooth out some of these separations and these little irregularities that also occur as a result of time. So many great options, and thanks for your time today.